When I first started learning to look at brain rehab in a different way, it was difficult for me to adjust my thought process regarding what patients would benefit from neuro-based OT. Previously, I worked in acute, skilled nursing, and home care where I used a neurological approach when treating stroke patients. I've used a sensory neuro approach in pediatrics, as I discussed in the primitive reflex video, but most treatments are often sensory diet exploration to desensitize and promote regulation. But it was typically a temporary improvement. The increased regulation went away when the patient stopped participating in weekly treatment sessions. I especially noticed little progress with my high-functioning kiddos, the ones that were smart yet had some processing difficulties or ADHD symptoms. Therefore, it was quite an adjustment when I started in a more advanced neuro rehab center. Most of their patients were very high-functioning. To be honest, they were so high-functioning that at first I didn't know how to help them. Many of their goals were for IADL and executive functioning. The patients often also had low tone, poor posture, decreased balance and body awareness, maybe decreased processing, poor handwriting, but those were not their chief complaints. One 16-year-old girl's main goal was to be able to study and take notes when she went to college. Another 32-year-old patient complained of headaches, irritability, disorganization, procrastination, and forgetfulness, which interfered with her ability to maintain a job. I also had a typical 6-year-old boy with sensory processing and ADHD, fidgety, seeking, easily overstimulated, sweet, and so fun. One patient that was a big learning curve for me was my kiddo with PANS. At that time, I had never heard of PANS, which is pediatric acute onset neuropsychiatric syndrome. The main consistent symptoms with PANS is tics, OCD, and anxiety. The clinic was also treating POTS, MS, TBI, early dementia, as well as people without a diagnosis. They may complain of migraines, fatigue, dizziness, and much more. Now I joke with my staff and clients that everyone has a brain, and therefore a CNSI approach is appropriate for most clients. I often have clients start with one child in treatment and then add in siblings and even themselves. I've even had some request cash pay to improve their tennis game, and I've never even played tennis. In my experience, no matter the setting you work in, I believe an OT using a CNSI approach can significantly improve patient outcomes.